Hi, this is Andrea Kane, and I'm here to talk to you about Chapter 19 in your book. This is for HSC 114, Medical Terminology. This is for summer 2020. You're in week 2, and we are talking about oncology, which is cancer medicine. These are our chapter goals. You can see here they're pretty similar to what we have and what we've been working on. The next video I'll be doing is on chapter 20, and that focuses on radiology and nuclear medicine. So we'll get into a lot more of the studies and tests and procedures in that next chapter, but they will be touched on in this one. And if you're looking at your syllabus, we're going to be doing Unit 15 learning objectives this time around, where we're focusing on oncology. So let's dive in. Here are some definitions for cancer and malignant tumors. And we'll go through this and explain it more. But pretty much what you need to know is there are tumors. There are benign tumors, which are non-cancerous, and there are malignant tumors, which are cancerous. Malignant tumors are the aggressive ones. They're the ones that are bound and determined that they are going to invade, destroy. They're going to not only be in the surrounding tissues, but they're going to get into the lymph system, and they're going to go up to the brain, and they're going to go over to the bones. They're the ones that aren't happy just staying in one spot. Benign tumors, although they grow and it's an excessive growth of cells, benign tumors tend to stay relatively encapsulated, relatively local. Benign tumors can be fast growing, but most of them are slow growing. Malignant tumors, on the other hand, they have set up their own blood system. They've taken over blood vessels that are nearby. They're like an army on the march that's building an empire and taking right over. They are not polite. Benign tumors tend to just say, oh, we just need a little more space. Oh, we just need a little more space. Oh, if you could just move over here, we'll just need a little more space. Neither one is really great. Both have to be dealt with, but you're dealing with two very different things between the two. Cancer is responsible for 20% of all deaths in the United States, and that's probably true. It may even be a little bit higher. It's very much an issue. Now, the plus side is they have come so far with cancer treatments that more than half of people who have cancer are cured, and they have many more years of life. Um, I know people who are undergoing chemotherapy right now. They have next to no side effects. Their prognosis for the future is very good. They may never have a relapse. I know people in my life who had cancer 25 years ago and have never had a relapse. So it just really depends. It depends on the type of cancer, the location of the cancer, how advanced it is when people find it, the different protocols that are available for it. There's a lot of variables, but the good news is that cancer is not always a death sentence anymore. Now, if you're talking about liver and pancreatic cancer, that's a little bit different. If you're talking about brain cancer, that also may be a little bit different. But on the whole, it's not necessarily a death sentence anymore. So, which cancers are the most common causes of cancer death for women? I will give you a hint. If you have breast cancer and it advances, it'll go lung, bone, brain. If you have colorectal cancer, it tends to go to the liver. I'll give you another hint. The number of women who smoke has increased over time. So, what are the most common causes of cancer death for men? Again, if you've got lung cancer, it often progresses to bone and brain. Prostate does the same, interestingly enough. Colorectal, again, tends to metastasize to liver. I'm going to let you check the internet for the answers, all right, on these two. We'll see how you did. All right, environmental agents are a big reason of why people develop cancer. There's a lot of chemicals. We deal with radiation. There's plenty of viruses going around. And we all know that we inherit genes from and I'm not talking about the kind you wear. I'm talking about the kind you inherit from your parents, your grandparents, your great-grandparents. There are things that are passed down to us, and the more science advances, the more we find that a lot of these things just happen to be in us. Or they happen to go wrong at some point. Somehow something gets a little twisted or a little changed or a little upset by something, and there you have it. Then you have, and that leads right into heredity. Some things we inherit and some things get changed through our environment. So let's talk about that. Hereditary cancers, they have found that these types of cancers are genetically inherited through genes that aren't quite right. Somewhere along the line they got twisted or changed, or somehow it's just not right and they ended up, these are things you can inherit. So, classification of cancerous tumors, because remember we talked about cancerous and non-cancerous tumors. We talked about benign and malignant. So again, if we're talking about benign or non-cancerous tumors, that's one category. If we talk about malignant or cancerous tumors, that's the other, and that's what we're focusing on right now is cancerous tumors. A lot of them are epithelial cell origin. Think about your epithelial cells. Go back to the first couple of chapters we covered where it talked about your layers of skin. So epithelial tissue, ooh, this gives us a really good idea of where that is and where that's located in the body. I'll let you focus on that for a few seconds and then we'll move on. We have a lot of epithelial tissue in our bodies, don't we? There are sarcomas. Now, sarcomas are usually pretty aggressive. They're not very nice tissue, or not very nice cancerous tumors. And we have them in our bones and our muscles, our blood-forming tissues, nerves. Mixed tissue tumors. These are ones that can go in different types of tumors. They aren't just limited to one type of tissue like epithelial or connective. They can play with both. And that makes them harder to treat, as you can imagine, because your treatments are targeted based on the tissue it's in. And if it can go to both, well, that makes it a bit more challenging. Not impossible, just a bit more challenging. All right, so what are some descriptions? Now, it says here gross, and this is going to be viewed to the eye. When you think gross, just think this is what you see when you're eyeballing it, so to speak, versus microscopic, which is what the cells look like underneath the microscope. And now you get to microscopic. Here's what it looks like underneath the microscope when you look at those cells. You're going to hear about grading and staging of tumors. There is such a position as a cancer registrar, and cancer registrars, they gather information about grading and staging of tumors, and they keep it and it's shared across the nation so that you can understand what cancers are where and what grade do they tend to be, what stage do they tend to be discovered at, and all sorts of other information. So if you're interested in cancer registry, reach out to me because there are a couple of programs that are available for that, and it's really an interesting field to get into. But the grade of a cancer is the degree of maturity or differentiation under the microscope. Grade 1 is a good grade. It means it means that it's well differentiated, the cells are fairly clear, and it's not gotten wild and out of control. When you're talking grade 4, those are really wild cells. Those are or undifferentiated cells, or poorly differentiated cells. You might hear those kinds of terminology. And that's just typically a lower grade means that the cancer will be easier to fight, that the cells are not as aggressive. And the higher the grade, and the grades usually go from grade, I think they have a grade 0 now, and they go up to grade 4. And grade 4 is very poorly differentiated, and these are very aggressive cells. They are eager to take over and be destructive. Now, stage is how far it's spread in the body, and there are stages as well. And I'm trying to remember if, well, I guess we'll go see what the grades and the stages are. So this gives you an example for lung cancer, and it involves, and this is staging. Remember? Okay, so we'll go back to staging is different than grading. Staging is how far it has spread in the body. So this next one's going to be spread. So if it's not in the lymph nodes, if it's just in the lungs, no lymph nodes, no distant metastasis, it's a stage N0. Now, if you've got regional lymph nodes and they're involved, like your supraclavicular lymph nodes are involved, hilar lymph nodes, those types of things, mediastinal lymph nodes, that's an N3. That's pretty advanced. Do you have any distant mets? Do you have no metastasis, which is MO, or do you have metastasis present? Have they gone to the brain? Have they gone to the liver? Have they gone to the bone? Those types of things. All right, so what do you do about cancer? Well, there are surgeries. There's radiation therapy. There's chemotherapy. There's all sorts of things you can do. There is cryosurgery. There's something called fulguration. And obviously you want to biopsy it if you can to know what you're dealing with. These are types of radiation therapy. And again, we'll get into that a little bit more when we talk about radiology, but it's good for you to know here. These are all types of radiation therapy or radiation oncology. You may have heard of chemo and radiation. That's what it's referring to as the radiation piece. And these are terms that you'll hear, like a linear accelerator. So what are some of the side effects from radiation therapy? And this gives you a list. Because although radiation therapy is very good and very successful, it does have side effects. And they vary. They vary from person to person, depending on where in the body you're getting radiation therapy, depending on your overall health, depending on how much radiation you're getting, depending on how advanced your cancer is. It's all very unique to the person. So it's hard to predict who will have which side effects and how hard will these side effects affect their lives. Chemotherapy, there are different kinds of chemotherapy. It can also be called biological therapy. Depends on what you're using. Are you using, are you using a hormonal agent? Because a lot of times with breast or prostate cancer, hormonal influences are there. So here, this gives you an idea of the type of cancer and the type of chemotherapy drug that might be given, whether it's an antibiotic, whether it's, you may have heard of Taxol for breast or ovarian cancer. You may have heard of Lupron for prostate cancer. You may have heard of cisplatin for ovarian or testicular cancer. Those are all kinds of common ones that you may have heard of. And here are some more. And here it gives you some regimens. You may have heard of, oh, that person's on an ABVD regimen. Well, that's multiple chemotherapy agents used together to fight Hodgkin's disease, for example. There are also immunotherapy agents. They're constantly developing new anti-cancerous drugs. A lot of those are under research or considered experimental while they're trying to work those out. And some are already on the market approved by the FDA, Food and Drug Administration. So this gives you some terms and their meanings. And I'm going to fly through these because we're already at 15 minutes. Where does the time go? The cancer field is a really good one to go into, oncology, radiation therapy. It's very rewarding, but it's also very challenging because you do lose patients and you do get attached to people and you do mourn their loss. So having worked with oncology clinics, oncology physicians, radiation therapists, radiation therapy physicians, and their staff in hospital and clinic settings, I know that they love what they do, but they hate the fact that the patients have side effects. They hate when they lose a patient. So if that's something that's of interest, it's a very rewarding field, but just be aware of the balance because there are times when you have to say goodbye. And again, cancer registry, if you're someone who may not want to work directly with patients, but you want to be in the medical field, cancer registry is a great opportunity to do that. And cancer registry is one of those fields that once you get an associate's degree in health information technology and then you take your cancer registry certification and you finish and complete that, you'll be able to work from home because most hospitals and clinics have electronic records now. And so doing cancer registry is primarily something that's done remotely from home. So if that's something that interests you without being a hands-on caregiver, make sure you reach out to me and talk to me about it because that is a great field to go into and there is a demand for it because so many of the cancer registrars that are there now are looking to retire in the next 5, 10, 15 years. And so more terms and more meanings and definitions. And of course, in the oncology field, they need researchers, they need physicians, they need physician assistants and nurses. They need medical assistants, pathologists. Those are physicians who are trained to do all of the microscopic work and identify and diagnose exactly what those cancer cells are and what does it mean for the patient and for the physicians that are going to care for that patient. Lab techs who actually take the specimens or the biopsies and prepare them for the pathologist to view. So there's lots and lots and lots of exciting and interesting careers that can be in this part of it. And then, of course, you get into your major medical centers, and they not only have all of these ways and procedures to detect and treat cancer, but they also really specialize. So let's say you're interested in the digestive system and you're also interested in oncology, you could end up in a major medical center or a major university working specifically with digestive system cancers or specifically with a different kind of cancer, like maybe neurological system cancers or respiratory cancers, those types of things. And here are abbreviations. Lots and lots of abbreviations. One of these that I'd like to point out to you is TNM, tumor nodes metastases. That one is one you will hear very commonly with oncology. TNM, tumor nodes metastases. That's part of staging. All right, that's it for oncology. I will be back shortly and we will talk about radiology and nuclear medicine.